Evening.
Hi, good evening.
Good evening.
Good evening.
All right, let's begin.
Evening.
Does anybody, so Tuesday, remember, is kind of the quote unquote lecture where I go through the material. And then today is just question and answer. So I'm here to help. Do you have homework questions? Do you need help with SAS, help with technology? What do you guys want to go over?
Dr. McBride, this is Adela.
Yes.
I have a question for number 22.
Absolutely. Fantastic way to start.
Yes, so I have been a little bit stumped with applying the definitions for the randomized complete block design and Latin square design to this problem.
Yes.
Because I just want to make sure that I'm understanding the main difference between both of them.
The main difference is the blocking, really. So a Latin square design requires the same number of factors in each treatment. So for instance, the number of glazes would have to be 2 to match the 2 thicknesses. But in the case of here, in this question, I think it's 4 and 2. Yeah, 4 different glazes and 2 different thicknesses. So that's why it's not a Latin squares design.
Okay. And then, because I know for my first submission, I chose factorial, which was not correct.
Correct.
But and this is not really a randomized, right? Because
Well, it feels like it might not be, but it is in fact a randomized complete block design.
Okay.
And it's because it's being blocked by days. Can you see how he's basically redoing the experiment every day? Or
right.
I shouldn't assume it's a male, but they are, redoing it every day. And then it's a 2-factor structure where the factors are the type of glaze and the thickness. And each day they mess around with those, to see what kind of differences they're getting. So that's why it's considered a quote unquote randomized block design, is because you could almost think of each day they roll a die to randomly decide, okay, what glaze am I going to use and what thickness am I use? So that's kind of where the randomness comes from.
Okay, so the days are the that is being repeated are the blocks in this case?
Yeah, it's blocked by days, absolutely.
Okay, thank you.
Yeah. And that really comes from the fact that, it says that conditions vary day to day. The experiment was conducted over an 8-day period. And then here's the biggie. Thickness and type of glaze is randomly assigned to one pot in the kiln each day. So that's how we recognize that it's blocked by day, because something is being assigned to it each day. It's saying that it's being randomly assigned. So now we know it's a randomized complete block design. And it's the blocking we know is each day. And then we can figure out the factors because, well, the only 2 factors that they're messing with, right? The only 2 kind of independent variables that are being randomized is the type of glaze and the thickness of the pots.
Right, okay, that makes sense. Thank you.
Awesome. What else? All right, well, if nobody's going to ask about it, I'm going to ask about it, get you guys talking about it. On the very first one, this one throws students for a loop every single time. And the main reason why it throws students for a loop is you think about it too much in the real world. When you're evaluating a statistical study and you're hypothesizing about what could be done to improve said statistical study, to get rid of confounding variables and things like that, you have to step out of reality. You have to basically get rid of all ethics and laws and rules. And you have to think about it in a pure experimental statistical way, because oftentimes the only way to get rid of confounding variables is to do horribly unethical things, which of course we would never do. These are thought experiments. So that's the first thing I will, tell people to, you kind of have to take your ethics away when you're answering some of these questions. So for instance, in the first one, a hospital introduces a new screening procedure to identify patients suffering from a stroke so that a new blood clot medication can be given to the patient during the crucial period of 12 hours after the stroke begins. The procedure appears to be very successful because in the first year of its implementation, there is a higher rate of total recovery by the patients in comparison to the rate in the previous year for patients admitted to the hospital. Okay, so when we're thinking about, what this study is doing and how to evaluate the study and how to figure out, what all the bits and pieces are, you always have to, kind of remind yourself is, well, the response variable is the thing that we're measuring to try and see a difference in, right? Normally an experiment or any kind of research is done where you identify a problem, something is not working right, and then you come up with a hypothesized solution. I think that if I try this new intervention, things will get better. So you try that new intervention, you measure the response variable that you're hoping gets better, and based on the explanatory variable, the thing that you're allowed to change, you're trying to see if that has a cause and effect on that response variable, all the while keeping an eye on confounding variables, things that you don't have control over, that could also possibly influence why your response variable, measures changed. So in the case of this one, let's look for the response variable first. What's the thing that we're measuring that we're thinking changes from, one part to the next?
Is that the
Aid
response?
recovery.
Yeah, exactly. It's the recovery, right?
Sure.
They had a certain recovery rate. They weren't happy with it. They thought of a new intervention, and that new intervention is a new screening procedure with a new blood clot medication. And then they're going to now measure that recovery rate and see if there's a difference. And of course, they're saying, yeah, there's a higher rate of recovery. So there seems to be, this new screening procedure and new blood clot medication seems to help. So we can see that the response variable that we're measuring is this recovery rate. Okay, so what's the explanatory variable? What's the thing that they can control for that they're hoping makes a difference between the two groups?
That would be the screening procedure.
And more specifically? Because you're correct, but more specifically within that screening procedure, they're also controlling
The medication being provided.
exactly that new blood clot medication, right? So it kind of goes hand in hand with the screening procedure and the new blood clot medication, but it comes down to the new blood clot medication is really kind of the backbone explanatory variable. That's the thing that they're hoping is going to quote unquote cause this higher recovery rate. Well, what are some confounding variables, right? So confounding variable number is something that could possibly influence the thing we're trying to measure, in this case, recovery rate, but it's something that we aren't controlling for, something that we basically don't have control of.
So the patient's medical history or how they're responding to the actual medication
Sure, absolutely.
be
What else?
different.
Yeah, absolutely. What else?
Thinking comorbidities,
Yeah.
that they age and
Sure. And think about even further, right? Again, you got to get rid of ethics. Think about in your head, if you wanted to run this experiment and truly determine if the blood clot medication worked or not, what would you really have to do?
It would be the amount administered to the patients, right?
Right. You would have to basically let some people get the new medication and some people not, right? You'd have to have a
Right.
control group. And that's what I mean by unethical. It'd be very unethical for a hospital to go, you know what, I'm just not going to give you this medication because I want to give you a sugar pill instead and see if the other medication works on other people, right? So that's what I mean by the ethical. So this whole new procedure itself is a confounding variable because they're comparing recovery rates to the patient's last year. Well, crap, everything's changed since last year. You could have totally different doctors. You could have totally different nurses. You could have bought better equipment. Your population of patients could have changed drastically, right? So, I mean, the whole thing is just crap from the ground up.
So when you're talking about the confounding variable, do you look to cite everything, or do you look for an explanation of solving for that confounding variable, such as an actual full randomized study? Would that be the better definition?
Well, exactly. I think if you think about how could I get rid of confounding variables, or how could I design a study that would actually test this blood clot medication accurately, and if you can kind of, as a thought experiment, think about what that experiment would look like, and then ask yourself, okay, how does that experiment differ from what they're actually doing? And then when you look at that, you go, holy crap, there's a lot of confounding variables going on and what they're actually doing that aren't being controlled for. Because if I wanted to do it the right way, I would have done A, B, and C over here, and they're not doing anything close to that. So I think when you think about it that way, it helps you figure out where those confounding variables are. Now, as far as what I'm looking for a homework answer, I'm just looking to make sure that you guys understand the basics in the process, that you've listed some things that would confound the results, and then you describe a situation that would control for those. And please, by all means, go for the, shoot for the fences and describe a situation that would test this new blood clot medication in the most ideal situation possible, ignoring all ethics and laws and procedures.
So is the primary confounding variable here then the patient's response to the new medication?
No, because that's what we're actually measuring. That's the actual response variable.
Okay.
I would say that the major confounding variable with this is the fact that we've changed everything. It's basically the whole new screening procedure. The fact that we're doing it now instead of last year, too
Right.
much has changed. So it's kind of like the whole screening procedure itself is a confounding variable because of that.
Okay, I see.
Professor, I assume that because this was an observational study that we couldn't change the entire format of the survey. So it's like they were passively making the comparison to the prior year. So I didn't think we can change that actual format. We had to give suggestions based on the type of study that it was. So am I hearing that when it's asking us to explore how we would change it, that means you can change the entire design with your suggestion?
Well, I love what you're saying. It would be great to be able to try and think of a way to better the study in the situation that it's given. And if you want to do that, that's totally fine. And I will absolutely give you full credit for that. But if you also want to think outside the box and go, okay, well, even if I tried to change the study within the confines of the way this study is designed, I can tell that it's just not going to be great no matter what I do. So if I really want to get rid of these confounding variables, this is what we would ultimately have to do. We'd have to pretty much redesign it from the ground up and do it this way. Either one of those responses would be fine.
Well, thank you. Well, I appreciate you clarifying. We didn't have to be ethical here because when I was looking at them, like, no one would ever do this in a study. So anyway, so thank you for clarifying that.
Yeah, it's a common problem with students, especially if they have, the least bit of medical background. They're just like, well, we can't do this. This is completely unethical. I'm like, yeah, I know. That's why we don't do it. The only way to really test medicines is to have an actual clinical trial where patients voluntarily know that there's a chance that they're getting a placebo. You couldn't do this to just, the random people coming in off the street having a stroke and going, you're going to go into the control group, you're going to go in the treatment group. That's how lawsuits are started. All right. The second one, I think, is a little bit clearer as far as the explanatory variable, right? What is the thing that we have control over that we're hoping will cause an effect?
Use of the software.
Yeah, exactly. The new software. Fantastic. And obviously the thing that we're measuring to see if there is an effect is their SAT scores, right? So that's the response variable. Now, what is the confounding variable here?
Well, I thought it could be that the student's performance before taking the SAT. They could all be at different levels of performance.
Great point. And the reason why that's not a confounding variable is you would measure pre and post and then look for a difference. So even if they were at different levels, you're still just looking at a difference between what they did before and what they did after.
I was thinking the selection process, because this is a self-selecting results. And so the teacher's not randomly assigning. My first assumption is the students that chose to use the computers had more confidence because they were already possibly high performers, whereas those with lower scores might feel less confidence and self-selected out.
Dwayne, you just got the gold star, man. That is exactly correct. That anytime there's any kind of self-selection, you get what's called self-selection bias. And I think it would be very logical for us to assume that the type of student who would choose to stay after school for an hour to work on this system is the type of student that's probably going to study more and do better on the SAT, regardless of whether or not this computer program helps. So that's definitely going to be a terrible confounding variable. Great job. All right. Albano?
No, I was just gonna say, how realistic would the use of such software be when the real SAT turn comes around? Because you might not have the option of using the software.
Well, I mean, if you really wanted to test whether or not the software had any impact, you would first of all have to have all the students take the SAT first, or at least a practice SAT or something, so you could get a baseline for them. Then you would have to do one of two things. You would either have to make all of the students work with the software and then do a post-test analysis and see if as a group their scores went up. And that's a weaker conclusion than if you had a control and treatment group where you randomly assigned some students to use the software and other students to use some other study procedure, maybe the old way that they studied for the SATs by just working in a workbook or something like that. And then you would see if the group that used the software's scores increased at a statistically significantly higher rate than the other group. And when you randomize those two groups, you would probably want to, do a stratified sample where, so you look at your pretest and you've got 30 students, and let's say you've got 1/3, did really well on the test, 1/3 were right in the middle, and 1/3 did very poorly on the test. You wouldn't want to randomly assign them to two groups because you might get all of the high performers in one group and all the low performers in the other group. What you'd want to do is you would take that 1/3 of the high performers and you would randomly split them into two groups. Then you would take the 1/3. So you put them in strata. You would take that second strata of the mid performers and you'd randomly assign them to the two groups. And then you would take that third strata of the low performers and you would randomly assign them to both groups. That way, each subgroup, right, had kind of a representative sample of the class, and you didn't have one group that was significantly different than the other as far as their pre-experiment aptitude is concerned. So those would kind of be the two different ways.
Got it. Thanks.
Yeah. I mean, the truth of the matter is, folks, designing a good study is a lot more difficult than people think. So that's, one of the main reasons why there are so many bad statistical analyses out there. There's just so much bad statistics floating around because designing a good study is not easy. And so if you've got a bad study, you've got bad results, plain and simple. Okay, anything else on this one? All right. Any other homework questions you guys want to go over?
Can we go over number 16?
No, I'm sorry. That's the one I won't go over. No, I'm kidding. Of course. Yeah.
Yeah.
Okay. Where's the trouble coming from? You want to just go through it step by step, or is there a specific part that's giving you troubles?
Well, if we can just go over maybe like A and B.
Okay. So you've got this idea where you want to evaluate this new drug that we're going to call D1, and it treats a particular illness. You can just think of it, okay, maybe it treats high blood pressure. There's this kind of widely used previous drug, D2, that already shows, some sort of impact. It seems to help with high blood pressure. And you want to compare this new drug to it. So then you introduce a placebo, because you have to have your control group. You go out and you randomly select 10 hospitals for your study. You do a thorough evaluation of the hospitals, and you conclude that there may be aspects of each that could result in, elevation of responses at some of the hospitals. And then each hospital has 6 wards of patients. So you're going to randomly select 6 patients in each ward. There's no reason why it should be 6 and 6. That's just happenstance. Don't think that has to be the way that you have 6 wards. You have to have 6 patients per ward. But 6 patients in each ward to participate in the study. And then within each hospital, 2 wards are randomly assigned to get D1, 2 of the wards get D2, and 2 of the wards get placebo. So you can see that right off the bat, they recognize that the hospitals were different. So it's almost as if they have a cluster sampling where each hospital is its own cluster. And that already is going to be a bit of a problem because, like she said, like the researcher said, she does this evaluation and she figures out that each hospital, has these much different aspects. So you would want to come up with a way to level the playing field and figure that out. And probably what you would have to do is kind of look at pre and post data and use the pre-data for each hospital as kind of a baseline for then what happens afterwards. But in any case, all 6 patients in each of the wards are given the same treatment, right? So all 6 are given either D1, D2, or a placebo. And then they measure a bunch of stuff. They measure their age, their BMI, their blood pressure, and then of course they measure their degree of illness. So in this case, if these drugs were about cholesterol levels, then the quote unquote degree of illness would be their cholesterol levels, right? So they're trying to keep it generic by talking about it just treats some sort of disease. So you have to measure how sick they are and how much this drug helps or not. And it's recorded for each patient upon entry into the hospital, right? And then the response is an assessment of the degree of illness after 6 days. So you can see that she's trying to control for the differences in the hospitals by getting that pre-measurement baseline. Not only is she measuring their degree of illness before they start treatment, but she's also measuring these other things that she thinks might be a confounding variable, like their age, their BMI, and their blood pressure. And then if she thought there were other aspects of the hospital that were a big difference, she'd want to measure those as well or capture those as well. But in any case, all right, so factors, right? Now, don't tell me what the specific factors are. Can somebody tell me in general what are factors? Remember, we've got factors and then we've got response variables. So the factors, go ahead, Dwayne, or somebody.
So I'm thinking the factors are the each of the measurements. So age, BMI, blood pressure. Those are all of the sort of inputs.
Good start, but factors, remember, are the things that we have control over as the experimenter.
Are those independent variables then?
Yes, exactly. You think about the factors are kind of the independent variables. We try and stay away from the words independent and dependent because we only technically are supposed to use those words when we have a true rigid scientific experiment in a lab. Here, we don't really have that. So that's why we call them factors and response variables instead. But you can think about them as independent and dependent. I always tell my students, think about them as you have a little machine and it's the input and the output, right? So the things you're going to put into the machine and the things that are going to come out of the machine. So what are the factors? What are the things that the researcher has control over that are going to be the independent variables that are going to hopefully cause a change in the response variable?
So would it be ethics away again? Would it be safe to say that selecting the patients based on their gender, race, or anything else could be a factor?
Well, you're getting more confused with what possible covariance or confounding variables be. The factors, remember, are what we have control over. We don't have control over a patient's age or BMI or blood pressure. What do we have control over?
The drug?
There you go, Tamika. Great job. The factors is simply the type of drug. And then what would the factor levels be?
The amount of drug?
Well, it would be D1, D2, and placebo. So in this case, the specific drug that they got, because it's not as if they had one drug and they said this group is going to get 20 milligrams, this group is going to get 40 milligrams, and this group is going to get 60 milligrams. Then yes, you'd be talking about the amount of drug. Here instead, this group gets D1, this group gets D2, this group gets a placebo. So those are the factor levels. See, those are the things we have control over. We control which group gets which drug.
So I have a quick question on that, just because I'm wondering here. So I'm thinking about those levels. Is the researcher controlling as a sort of input how long to wait for the response? Is there any case where that 6 days of treatment itself becomes a factor?
Well,
Such as 6 days for one group, 12 days for another group. I'm just trying to think how this might change in other situations.
yeah, it's a good thought. I would have to say that, people's metabolisms do work differently. So you could see slight differences in how fast two patients would recover from a drug based on things like that. But I think, once you start drilling down, there are so many. That's one of the reasons why it's really hard to run experiments with humans, is because we are fuzzy, right? I mean, there's just so much differences between one human to the next that it's really hard to iron out all the wrinkles and control for all of those different variables. So what you have to do is you have to get a large enough sample that the fuzziness just gets absorbed. And I think what's happening here is she's assuming that if she waits 6 days, it's long enough to see an improvement in an average patient. And so that's kind of what's going on. But yes, you're absolutely correct that the length that they're waiting to measure could absolutely, be, I wouldn't call it a confounding variable, but it definitely could influence what kind of responses we're seeing. And then, of course, if you really wanted to kind of control for that a little bit better, well, you could measure them every day for 12 days, right? And then you're kind of taking time out of it because you can see what happens over the course of 12 days. So there are ways to somewhat control for it. But yeah, I mean, you're going to see patient A is feeling a lot better after 3 days, whereas, patient B, who got the same exact drug, maybe doesn't feel better until day 6 or 7. Okay, what else? How about blocks? Anybody got any ideas what the blocks would be? And let's think about this in terms of We already talked about the experiment that the potter did with the different glazes and the different thicknesses. And it was blocked by day because every day they tried a different combination. Well, where were all the different combinations done here? What were the blocks here?
Would it be the different hospitals?
Perfect, exactly. And then what would be the experimental units? Now remember, the experimental units are the things on which we take the measurement of our response variable. So what do you think the experimental units are?
The amount of drugs.
Well, they're all getting the same amount of drugs, and the response variable that we're measuring is how sick they are. What are we measuring that on?
The patients themselves.
The patients themselves, exactly. So the patients themselves become the experimental units. Now, if any of you have gotten your grubby little hands on the solution manual for this book, it lists the experimental units as the wards. I think that's absolute crap and wrong, because an experimental unit is the thing on which you are measuring your response variable. You're not measuring the degree of illness on the wards, you're measuring it on the individual patients. Now, technically, I can see why they could argue that each ward is an experimental unit, because all 6 patients within each ward get the same drug. So that's why I think the book is saying that wards are the measurement units, because you could technically think of all 6 patients as a group. You're going to measure the illness on all 6 patients from that ward, and then that's going to become the measurement for that ward. But if you look up the dictionary definition of what an experimental unit is, it plainly says the object on which you are measuring your response variable. In my mind, that can't be any clearer that it's a patient. You could also then argue that if the experimental unit is the patient, then you could argue that the blocks might even be the wards, right? So there's a little wiggle room between what correct answers would be for C and D. I'm glad Grubby Little Hands got such a funny reaction for everybody. I try and keep it light, folks. I know how boring statistics can be. All right, so again, by definition, experimental unit is the thing on which we are measuring our response variable. And by definition, the measurement unit is simply just the unit of measure on our response variable, right? It's feet, it's inches, it's centimeters, it's a unit of measure. That's what a measurement unit is. And again, the book gets this one terribly wrong, because they say the measurement unit is patients. You're not going to the ward and measuring patients, right? If the ward was the experimental unit and the measurement unit was the patients, then that would mean you went to each ward and you measured patients. You basically measured how many patients were in that ward. That's not what we're doing. We're measuring degree of illness on our patients. So our patients are the experimental units, and our measurement unit is degree of illness.
So when you have to classify or when you have to determine which patient has the most or least illness, and then when you determine that, wouldn't you have to classify those patients with different stages of the illness so you can start the measurement? Like this guy is like, he's been ill for 5 weeks with this particular blood pressure issue, and this guy just started. This guy has comorbidities. This guy here smokes. Is that kind of what they mean?
Well, those are all confounding covariates that you would be measuring to try and get rid of some of the fuzziness. But as far as the measuring is concerned, you are measuring everybody's degree of illness. And so if you wanted to think of it in the context of, I'm going to take patient A, I'm going to measure how sick they are, and then that's going to become almost like their name. Then within the ward, I have these 6 kind of degrees of illnesses walking around. Instead of patients, I'm just thinking of all 6 patients as just being degrees of illnesses that are walking around. Then that's how you would be able to classify the patients as the measurement unit, because you're just, your unit of measure is a patient. But I personally still don't see how that works, because how do you measure a patient, right? You can't, a measurement unit is feet and inches. So you're telling me that if the measurement unit is patients, then I can have like 1.2 patients. I can have, 4.5 patients. I can have 0.7 of a patient, because I have to measure something, and the units that I'm measuring in are patients. Like I can say that room over there is 5 patients long, because that's my measurement unit. That doesn't work in my world. For me, the measurement unit is the unit of measure that describes your response variable. And your response variable is how sick they are. And you measure that by measuring the degree of illness. Now, if it was something simple as we were trying to see whether or not this lowered cholesterol, then the measurement unit would be, I don't know, whatever the hell cholesterol is in, kcals, or, that kind of thing. If you want to, if it was a pill that people were supposed to lose weight, then the measurement unit would be pounds or ounces, that kind of thing. But since this medication is just supposed to help people get better for some generic illness, then all we are doing is measuring how sick they are and that degree of illness. And that measurement unit is literally just degree of illness. How you designate that is up to you. I mean, you could have a Likert scale and you just ask them, how sick do you feel today, right? You could take their temperature, you could assess their bowel movements, you could, listen to their ears and listen to their breathing and do all the things that a doctor does. And then at the end of it, kind of give the patient what we call a scale score. And a scale score is normally when you are measuring something on multiple things and you kind of aggregate it all together and give them one scale score. So you are measuring all these different things to determine how sick a patient is. And at the end of it, you give them a score and say on a scale of 1 to 10, see, scale for scale score, this patient is still at a sickness level of 7. Well, that becomes your measurement unit. That scale score is your measurement unit. And the experimental unit, in my opinion, is still the patient, because that's the thing upon which we are taking these measurements. Anything else?
Could we
Dr.
go over?
McBride, go ahead.
Sorry, could we go over 13B, please?
Sure. Are we cool with the rest of these?
I only had a sub question to measurement unit. So I get it why it's the degree of illness. I can slightly confuse it too. Could it also be the outcome of the experiment, meaning how well these people got, how good their cholesterol got afterwards? Could that be a measurement unit too?
Yeah, exactly. Because the measurement unit has to be something in relationship to the response variable. So you can always look at both sides of the coin. You're either measuring and reporting how sick they still are, or you flip the coin over and go, how much better have they gotten? You can see how that's the same measurement.
Okay, thanks.
Yep. Okay. 13. Okay, so what kind of measurements, right? What kind of sampling method would we use for each of these? Well, a major state university in the state is attempting to lobby the state legislature for a bill that would allow the university to change a higher tuition rate than the other student or other universities. To provide a justification, the university plans to conduct a mail survey of its alumni to collect information concerning their current employment status. The university grants a wide variety of different degrees and wants to make sure that information is obtained about graduates from each of the degree types. So a 5% sample of alumni is considered sufficient. What kind of sampling, right, would we use here then?
Stratified?
Awesome, very good. Yeah, because we want to make sure that we're sampling from within each of the different degree types. Those are our strata, right? So we want to take a random 5% sample of degree A and a random 5% sample of degree B and C and so on and so on and so forth. Very good. Okay, this is the one people always get wrong. The EPA is required to inspect landfills in the US for presence of certain types of toxic material. The materials were sealed in containers and placed in the landfills. The exact location of the containers is no longer known. That's the key. The EPA wants to inspect a sample of 100 containers from the 4,000 containers known to be out there in landfills to determine if leakage from the containers has occurred. How would we go about obtaining that sample?
I was thinking about using clustered only because I know you're looking at heterogeneous groups, but I think the simple one goes with not knowing the exact location. So I wasn't sure if it was like a two-step process or which one will be better between those.
Yeah, and that's exactly where the problem comes from, is a lot of students think they're going to do a cluster sampling, thinking that the clusters would be like each landfill or something like that. But the problem with that is, as you said, they don't know the exact location of the containers. So the only way to do this one is to just do simple random sampling. Just keep poking a stick into the ground until you find 100 containers and then you stop.
Right, thank you.
Yep. Anything else?
I have one if once everyone's done with their questions, because I want to go back to something you already talked about. So
Go for
I'll
it.
wait to see.
No, you're fine.
Are you sure? Does anyone have any new questions? Okay, I'm still really struggling with that 2.21 where the math assignment, I guess it didn't state that she did a pre and post test. It's just saying, based on how this study is being done, what are the confounding variables? So the fact that the students' aptitude to actually do the subject is not a confounding variable. Maybe I'm thinking too literal about it, but I'm not getting the piece of she asked the students, and so therefore it was biased. It sounded like she offered the students an opportunity, so all students had an equal opportunity to do it or not do it. So it's not like she specifically chose them. So I'm trying to get my brain like how I would have recognized that.
Well, no, you're absolutely right. There's nothing in the description that says specifically that the teacher did any kind of pre and post test to kind of control for aptitude. So you could absolutely make an argument, a valid argument, that the student's predisposed aptitude for math would be a confounding variable. But you could also argue that no matter how good or bad a student is at math, if the thing helps, it would help everybody. Now, the fact that they say in it, the students using the software had significantly higher scores on the SAT than did the students who did not use the software. Yeah, you're right. It doesn't say anything about, comparing it to their previous scores. So, but it does say that, they're hoping that the software program will improve math scores, which would make me think, well, how would I know if it improved if I didn't know what they did before, right? So yeah, I'm with you. They don't explain it well enough for you to know that they're actually doing a pre and post. So with the absence of a pre and post, then their own aptitude is a huge confounding variable for sure. But regardless, no matter which way that was going, whether they did it pre and post or not, I think we can all agree that the self-selection bias is there, right? That's the obvious compounding variable. But yes, you could absolutely argue that their own aptitude would be a confounding variable, because nowhere in the description of how the study was presented did they control for that by doing a pre and post.
Okay,
I mean-
thank you for explaining that. This gets kind of confusing because you have to really think
Yeah.
and make a lot of assumptions. And I'm like, oh God, if I got that wrong, I'm gonna really have a hard time. So
No, that was a good question. I'm glad you brought it up. And when I grade these things, I have a wide swath of correct answers that I accept, as long as somebody presents their argument clearly, concisely, and accurately. I will accept anything, right? So if you want to argue that their own math aptitude is a confounding variable, as long as you can, describe why in a good manner, do it well, then I will absolutely take it, right? If you can give me a compelling argument, I will accept it, because these things are, all of these questions, well, not all of them, some of them are pretty straightforward, but most of them have enough ambiguity in them that you could, kind of argue a different way here and there.
Yeah, I was going to say that question stuck out to me just because of how bad it all was. One of my first assumption was that the high school mathematics teacher was a confounding variable, because probably shouldn't have a researcher in charge of research who's absolutely convinced of something working. So there's no sample size here for statistical validity. So I looked at that one. I'm like, oh my God, this is just all horrible.
Right. Exactly. Yeah. And that's what we normally see when we see a lot of these things being published.
thank you.
Yeah, of course. Thanks for asking. What else? Okay. Any questions on SAS? Have you guys been able to get registered and get going on that?
I went as far as registering. Haven't had a chance to do a little more on it, but at least I have the account up.
Okay, so you got the email back and you were able to get in, log in and do all that?
So it's not funny, but I didn't get an email back, but I was able to log in.
Oh, okay.
Maybe the email came and it might be in my junk email. So
Because usually you have to wait for an email, and then that's what allows you to like set your password or something.
okay, Allison, did you get that? I know you said yes on the comments.
I didn't, and then I requested to get access, like I emailed somebody, and then all of a sudden I was able to log in, so it was really strange.
Okay. All right. Well, whichever route you guys got to take, just get it done. But remember, you don't have to do SAS. The school no longer requires it, and I am more than happy to help you do everything with a TI graphing calculator, using Excel, using StatCrunch, Vaster Stats, SPSS, any of those other things. But other professors will not be so nice. They will only help you in SAS because they don't either know the other programs and don't want to take the time to learn them, or they just have a bug up their butt or whatever. So your safest route is to learn SAS.
So I try, watch the videos. I guess it's hard unless you have an example to walk through it, because when you start talking about bins, I was like, okay, I don't know what's going on here. So I was like, let me wait until I have an actual problem that I can work through, and so that I understand why it's leading me to certain functions. But the bin thing kind of threw me off.
Yeah, so the bins are when you have data that you need to group. So it's normally either when you have discrete data that is spread out, or when you have continuous data, that has infinite numbers of possible outcomes. You can't do like a bar graph for all of them because you have an infinite number of bars. So you put them in what are called classes, right? So like if you were talking about maybe scores on a test, you would show all the scores that were 90 to 100, right? And then 80 to 89 and 70 to 79, and so on and so forth. each of those classes in SAS are called bins. So if you took your grades and you broke them up into 5 classes, so A's, B's, C's, D's, and F's, right, would be your 5 classes. Those would be considered 5 bins. That's just the terminology they use.
Oh, okay.
Yeah. So a bin is a class. And I would suggest for all of you, if you get done with this homework early, or basically as soon as you are done with this homework, please start playing around with next week's homework and SAS. Because you just want to spend as much time as you can just playing around with the program. You can't break it, right? So don't be afraid to just push buttons and just play around with it and see what the hell happens. You know, that's how we learn. I mean, we really learn like, you know, chimpanzees just poking at things and figuring out what the hell they do. So just play around with them and you'll get better at it just doing that. And then, you know, I'll help you guys walk through things and I'll show you specifically how to do things the more efficient way and so on and so forth. But just get comfortable with it, playing around with it on your own so you're not afraid of it. And you can see that, you know, I can't break it. It's not going to break my computer. It's not going to, you know, smoke's not going to come out of my monitor. I can just screw around with this thing all day long. And, you know, if it doesn't work, it doesn't work. Big deal. All right. Anything else before we go? Okay, well, we'll get out of here a few minutes early. I once again want to thank you all for showing up. It's always appreciated that I don't have to, you know, talk to a void. I guess I will see you all Tuesday at 8 for our, I'm sorry, yeah, Tuesday at 8 for our quote unquote lecture time. And then don't forget, please, if you can't make any of these, in addition to the video for this specific one that I will put up either later tonight or tomorrow, there are always all of the older ones that are on that sheet in our Google Drive that are great resources to watch because, you know, we only went through 2 or 3 questions on the homework today. If you went back and watched all of those other ones, I can almost guarantee that I've gone through every single homework question at least once at some point in one of those videos.
That is so awesome. Thank you.
Yeah, absolutely. All right. Any other closing remarks before we go?
No, thank you. This is awesome. Appreciate it.
My pleasure. Happy to help. That's what I'm here for.
Thank you.
Yep. All right,
Yeah,
everybody.
thank
We'll
you
see
very
you
much.
next week. Thanks, guys.
Thank you.
Thank you.